Good evening and welcome to the COVID-19 update on Channels Television. I'm Millicent Walker. First, the highlights. Anambra state government goes tough on COVID-19 safety protocol defaulters, hands down penalties. Yobe state government partners tricycle riders to improve mask usage. And G7 member nations pledge to share surplus vaccines with poorer countries. Africa has recorded more than 100,000 deaths from COVID-19, a grim milestone as the continent of about 1.2 billion people battles a second wave of infections. Data from an AFP tally compiled from official sources says the 54 countries in the region have a death toll of 100,000 from over 3.7 million cases. The continent is the last except Oceania to reach the threshold of 100,000 deaths, which Europe crossed in April 2020. South Africa, the worst hit African country, rolled out a mass testing campaign at the start of the pandemic. To date, the country has recorded nearly 1.5 million cases and more than 48,000 deaths, while it has also rolled out its vaccination. However, according to health experts, the figures based on the daily reports communicated by health authorities only reflect a fraction of the actual caseload. They believe the numbers might be underreported due to poor access to healthcare facilities and underreporting of milder cases. Africa still suffers from understaffed health facilities, lack of means to do mass testing, and most of its cases go unnoticed with asymptomatic patients or with symptoms that can be confused with other diseases. However, the toll in Africa is significantly lower than in Europe, the world's most affected region, with over 800,000 deaths recorded. The other regions that are badly hit are Latin America and the United States and Canada. Meanwhile, in Nigeria, 877 new cases were confirmed in 25 states and the FCT. Until date, confirmed cases have surpassed 150,000, with 16 deaths recorded, putting the death toll at 1,803. And most of the new cases were recorded in Lagos, Kaduna Rivers, Akwa Ibom, Ebonyi, Edo, Ogun, and some of the other states, as you can see on your screen. In the meantime, Anambra State topped the list of cases of COVID-19 with 344. This was on the 17th of February. Now, a situation that has the state government officials concerned about the rate of infections there. The Anambra State COVID-19 protocol enforcement team is harping on the need to observe the preventive protocols, and so far over 100 offenders have been apprehended and penalized.
In Onitsha, the Anambra State capital, the protocol enforcement team starts from DMGS roundabout and moves down to other major streets in Onitsha North. The team arrests defaulters who are in buses, tricycles, and those walking on the streets without face masks. To many, the exercise is commendable.
It is very, very encouraging. This epidemic disease has come. We still have our role to see how to manage it.
This disease is real and it's very deadly. It kills. So my advice to people outside there is that you should be very, very conscious of what you are doing. Maintain social distance with people. I really love this. This will help to prevent the diseases in Anambra State.
At the magistrate court in Onitsha North local government area, officials sentence offenders to community service or a 10,000 naira fine, or both, as stated in the Anambra State COVID-19 law. Community service starts immediately. The secretary to the state government believes this step is necessary to stop the blatant disregard of safety measures.
It is very important to, educate, inform people, admonish people, but at some point, the government needs to become very firm. It's not the case that the government is trying to punish people or make life uncomfortable for people, The alternative is to shut down the state again, but that is not necessary.
The recent exercise is putting many citizens on the alert, as some are now seen wearing their face masks properly, while sale of the commodity has increased significantly. Although Anambra State is 19th in the order of infections on the NCDC table and has only 500 cases on admission, state authorities want to make sure it doesn't get much worse than this.
In an effort to mitigate the spread of the second wave of the pandemic in Yobe State, the government has partnered with the Association of Tricycle Riders to launch compulsory use of the face mask by all tricycle passengers. The Director General of the Primary Healthcare Management Agency explains that the tricycle drivers meet the larger society and therefore partnering with them to sensitize the public will minimize community spread of the disease. The government also donated assorted face masks to be distributed among their members and passengers.
They represent an opportunity for us to actually control community spread of this pandemic. And I must, at this point, sincerely thank the leadership of the Association of Kekera Nafi Riders for the cooperation that they have given us when we started, even during the first wave of COVID. Alhamdulillah, the extent of the spread of COVID-19 in Yobe State is not like other states. This may not be unconnected with the concerted efforts and support of all stakeholders, including the Keke Nafi Riders Association. And now we are in the second wave of COVID-19. And we feel we need to re-strategize and re-engage these critical stakeholders, among others, to see that they contribute their quota towards further halting the community spread of this dreaded pandemic.
Over in Cross River State, the government is calling on all its residents to test for the coronavirus as the earlier vandalized testing centre during the NSAS protest is now renovated by the state government and equipped by the NCDC. Speaking at the Dr. Lawrence Henshaw Memorial Hospital IDH testing centre located in Calabar South local government area of the state, the Special Assistant to the Governor on Health, Dr. Uche David, explains that the testing centre is ready for sample collection with a higher module PCR machine with capacity to load at least 48 samples in a run.
This is our restored molecular lab testing for COVID-19. It also the Center for testing in HIV, TB, and all the infectious disease that the hospital was known for before the NSAS destruction. And we now have a higher module PCR machine, courtesy of NCDC. This machine has a capacity to load at least 48 samples in a run. That's compared with the statistics of the other machine we had before, which were either looted or vandalized. So now Cross River State is back, poised. The staff are very highly motivated. They've done so much to clean up the place, even without the involvement of assistance from outsiders. And all of that has now made it possible for us to resume testing. Testing has started here since last week, and the public is now very reassured that the Cross River State Molecular Lab for COVID-19 testing has been restored back to function. This machine is a very high output machine, very efficient, and takes so much at a time, and it has everything necessary to make it run for us at this time. But the rate limiting steps now will be how many people come or show up for sample collection, because they can only test for as many as they can collect from the public. So we encourage all who need the COVID-19 status to be checked to come here voluntarily and present themselves for sample collection.
The development and approval of safe and effective COVID-19 vaccines less than a year after the start of the pandemic is a remarkable achievement, offering hope that the end of this devastating crisis may be in sight. While wealthier countries lead the way, some African countries have started vaccinating their populations. Nigeria is yet to start. However, only yesterday, the review of AstraZeneca Oxford for COVID-19 was approved by NAFDAC, while Mrs. Ibiere Herbertson a pharmacist and the Deputy Director of Pharmacy Nigeria Institute of Medical Research, NIMA, joins us for more on that. Welcome to the program.
Thank you, Millicent. Good evening.
All right. When the WHO or NAFDAC says a vaccine is recommended for emergency use authorization, what exactly does that mean?
Okay, what NAFDAC is saying is this, that we have a public health emergency situation, and for that public health emergency situation, a vaccine is required, and there is no existing vaccine. But there are vaccine candidates that are undergoing clinical trial. So what NAFDAC is saying is that we have reviewed data from ongoing clinical trials, and from the reviewed data, we are sure that this vaccine has the right efficacy and is safe for use in the emergency situation until all clinical trials are concluded. Then the full approval will be given.
So having a shelf life of 6 months, 2 or more doses that can be stored at 2 degrees upwards, is this good? Is this favorable? We also understand in terms of efficacy, it can be tolerated for those 18 and above. Does that mean for children it will not suffice?
Yes, you've asked many questions in one, but let me start with a shelf life. That it has a shelf life for 6 months at between 2 and 8 degrees Celsius. Is good for us because that is the normal temperature for freezers that are used for routine immunization. So what that means is that at what we have, our normal immunization system, that from the dates of manufacture, this vaccine, if kept in the vaccine freezers that we use for routine immunization, these vaccines will last, they would retain their quality for 6 months. Well, this is unlike the Pfizer or Moderna vaccines that you need the extra ultra cool freezers, the -20. For this one, all we need is our regular freezers between 2 and 8 degrees, and the quality is assured. And the shelf life is actually the manufacturer specified quality if kept over a specified period. This is different from expiry dates. Expiry date could be longer. The expiry date says after this particular date, safety is no longer assured, quality is not assured. But for shelf life, we're talking just about quality, that if you store at this condition for the next 6 months, quality is assured. Then in terms of children, the ongoing clinical trials do not include children for the AstraZeneca Oxford vaccine. The participants for the clinical trials were aged between 18 and 65 years. So maybe after these clinical trials have been concluded, maybe another set of trials will now involve different populations like the children and maybe the older people and maybe even pregnant people. Like right now for some other vaccines, I think children from 6 years upwards are being recruited. But for the AstraZeneca Oxford vaccine, because children were not included in the clinical trials, we cannot give this vaccine to children right now.
So in terms of research, would you say that the AstraZeneca is best for Nigeria?
Well, I think it is good for Nigeria because a lot of things have been put into consideration, in terms of, retaining quality. We just talked about the shelf life, that in our existing conditions that we are used to, this vaccine would retain its shelf life for 6 months, which is good. And again, that this is not an mRNA vaccine like the Pfizer and Moderna. So the controversy about mRNA is not in this case. So people need not to be afraid. The technology for this vaccine is different. Then in terms of efficacy, after the first dose, the AstraZeneca Oxford vaccine has 76% efficacy. It was tried in the UK, in Mexico, and South Africa. So, you know, the Negroid population, so to say, the Afro, the Blacks like us were involved in the clinical trials. So we say in terms of our genetic makeup, it's likely to be the same effectiveness or efficacy in our population. So I think they have made a good choice. You know, people will say, oh, the Johnson & Johnson would have been better because it requires just one dose, you know. But then the Johnson & Johnson vaccine, you know, has a shelf life of just 3 months under the same temperature and storage conditions. So for us, would we be able to like procure and finish within 3 months? So if you look at that, we would say by choosing AstraZeneca, yeah, the Nigerian government has, you know, obtained or made the best choice for the population.
All right, well, I'd like to thank you, Mrs. Ebere Herbertson, pharmacist, Deputy Director of Pharmacy NIMA. Thank you for your insights into the issue. Thank you.
Thank you, Millicent. Bye.
Still to come, Chairman, Presidential Task Force on COVID-19 is asking Nigerians to fight the deadly virus. We'll tell you more about that story and some global updates. Stay with us. The Secretary to the Government of the Federation and Chairman PTF on COVID-19, Mr. Boss Mustafa, is again asking Nigerians to fight and restrict the transmission of the deadly coronavirus in the country. He gave the advice during the commissioning of projects executed by the Ecological Fund Office at the Federal College of Education, Yola, Adamawa State. It describes the virus as devastating, appealing to Nigerians to continuously wear the face mask and observe all the COVID-19 protocols.
In Nigeria, we have exceeded about 140-something thousand. We have recorded over 1,600 plus deaths. We are working very hard to procure vaccines. But before the vaccines arrive, use what you have now as a weapon to fight and restrict the transmission of coronavirus. I wish us well, but I believe the year 2021 will be a combination of our non-pharmaceutical interventions, that's the wearing of masks, keeping social distancing, and avoiding congregations, plus the vaccines that will arrive.
Now, the proportion of cases resulting from the coronavirus mutation first detected in the UK is doubling every week in Germany. According to its health minister, the B117 coronavirus variant now accounts for 22% of all new infections in the country. 2 weeks ago, the number of cases resulting from the mutation first discovered in the UK was just 6%. Officials fear that despite a reduction in the number of new cases, this could cause another surge in infections. Rob Watts, Deutsche Welle correspondent, joins us now for more on that. Hello, Rob. How big a threat is the UK variant perceived to be in Germany?
Well, it's seen as a major threat. I mean, it's currently making up 22% of the cases here in Germany, which may not seem like a large proportion, but when you bear in mind that just 2 weeks ago it was only making up 6%, that's an alarming increase. It's doubling in its proportion each week at the moment. So there's a real fear that even though the numbers overall are coming down here in Germany, that the UK variant could cause a third wave of coronavirus. And we're getting an idea of what potentially could come from the town of Flensburg in the northwest of Germany, close to the border with Denmark, which has just recently seen a boom in cases. It's gone from having around 50, 60 cases per 100,000 over 7 days to almost 200 cases per 100,000 over 7 days. So just in a matter of days, the amount of cases there has skyrocketed, and around half of those are thought to be because of this UK variant.
What's being done to prevent the variant taking hold?
Well, first off, in Flensburg itself, they're introducing tough new measures this weekend to try and control and contain the outbreak there. So there's a curfew kicking in on Saturday that means for at least the next week people can't go out between 9 p.m. and 5 o'clock in the morning. But also they're going to be stopping people meeting anyone from another household in Flensburg. Meanwhile, the rest of Germany is allowed to meet with one person from one other household. Beyond Flensburg itself, the broader German policy has been to close borders with countries that have got a high proportion of other variants that aren't already here in Germany, including that British variant. So this week they've closed the border with the Czech Republic and the Australian region of Tyrol, both of which have got high prevalence of the British variant. But the sudden closure of that land border has been causing problems, particularly for freight getting across the border, because now they are demanding that people turn up with negative tests, and those truck drivers who weren't aware of that before arriving are suddenly left with a huge delay. Beyond that, the government here is also hoping to test its way out of this problem, and it's introducing from the start of March free rapid tests for all Germans.
How about the vaccine rollout? Is it providing any hope?
Well, the vaccine rollout continues to be dogged with problems here in Germany. It's been a problem across the EU. There's been a shortage of 2 of the 3 vaccines that are approved here. But the latest problem is that people here are rejecting one of those 3 vaccines, the AstraZeneca vaccine. There's evidence to suggest that it's less effective than the other 2 vaccines, and also that it has stronger side effects than those vaccines. For example, we had a group of 300 ambulance workers in the city of Dortmund who had the AstraZeneca vaccine, and a quarter of them reportedly phoned in sick for work shortly afterwards. So that's actually led to representatives of healthcare workers urging the government not to give the AstraZeneca vaccine to health workers, because they fear that it could lead to staff shortages as people take sick because of the side effects. So that's a major problem. Now, the government here is throwing its support behind the AstraZeneca vaccine. It's saying it's been approved. That means it's safe. And also the health minister here has said he would gladly take it tomorrow. But of course, he's only 40 years old and a politician, and it's not his turn for some time yet.
It's rather interesting, the turn of events there with the vaccine rollout. Thank you, Rob Watts, Deutsche Welle correspondent, joining us there from Berlin. Now, UK Prime Minister Boris Johnson is pledging to donate most of the UK's surplus vaccine supply to poorer countries. In a speech to a virtual G7 meeting today, he urged rich countries to back a 100-day target for the developing new vaccines for future emerging diseases. The UK has ordered more than 400 million doses of various vaccines. So many will be left over once all adults are vaccinated. Here's more on the global update.
Russia has offered the African Union AU 300 million doses of its COVID vaccine, Sputnik 5. The AU says the doses will be available for 12 months starting in May. It's one of the biggest supply deals of Sputnik to date. The AU has previously secured 270 million doses of vaccines from AstraZeneca, Pfizer and Johnson & Johnson for delivery this year. Portugal has temporarily slowed down the vaccination of key workers such as police, armed forces and firefighters because of a shortage of doses. Head of Portugal's vaccination task force says the focus must be on saving lives. 90% of available doses will now be given to just 2 groups: people aged 80 and over, and people aged between 50 and 79 who have heart, coronary, kidney and severe respiratory diseases.
After my vaccination,
New Zealand officials injected a small group of medical professionals with the Pfizer-BioNTech COVID-19 vaccine today in preparation for a wider rollout over the weekend. The group chosen for the test run were vaccinators who will be administering the inoculation to border and quarantine staff from Saturday, February the 20th.
nice to see
Nice to see you. Thanks for retraining.
Mayor of London, Sadiq Khan, has received his first dose of a coronavirus vaccine. The Labour politician visited the vaccine centre located at the Mitcham Lane Baptist Church in southwest London. He was asked by his GP to receive the vaccine in the current phase of the rollout due to his asthma.
As we head into the weekend, continue to take responsibility. Visit our website at channelstv.com for more updates, a better understanding of the pandemic and the trends. You can also find other stories in politics, business, sport, all at your fingertips. That's our program this evening. Thank you for watching. I'm Millicent Mwonka. Stay healthy.